Today, I'm speaking with Catherine Bouvier. She's a leading advocate in the field of neuroendocrine tumors. She's the president of the International Neuroendocrine Cancer Alliance, and she's the CEO of Neuroendocrine Cancer UK. Catherine, it's an absolute pleasure to have you with me today. And I think we both care a lot about patients with neuroendocrine cancer. And unfortunately, it is a disease that is difficult to diagnose. It sees delays still in getting patients diagnosed. While on the other side, it would be a cancer type that is fairly well manageable with all the new treatment options. So I'm curious to hear, how did COVID-19 impact patients' care during these days? What are you hearing and what are you observing?
Oh, firstly, thank you, Susanna. It's lovely to be here and to be talking with you. And indeed, yes, care very much about our community and the neuroendocrine cancer community across the globe. And it hasn't been the easiest of times, I don't think, over the last few months. I also think we've probably heard this a lot because a number of patients across the whole cancer spectrum have been affected. And I guess we can say cancer doesn't stop because of COVID-19. And that's been our reality. We did a small survey, actually. It's a snapshot survey here in the UK. We had about 400 patients that responded. And it was fairly positive in terms of sort of access to healthcare. The majority of patients said there wasn't a significant change to their overall treatment plan. But we saw a huge amount of about 50% of the respondents talking about health anxieties, not wanting to contact their team, not wanting to bother anybody. We saw a huge increase in our requirement for our psychological service, our psychotherapy service, sorry. And so I think that was probably the most impactful sort of result that we got out of the small survey that we did. But I guess, you know, if you take that as a snapshot, there's what, 36,000, 40,000 people living in the UK with neuroendocrine cancer. If that many people, sort of 50% of that, all have psychological, you know, trauma from this disease, from the COVID pandemic, then, you know, that's quite significant.
Yeah, it is. And I don't know, I mean, I guess your organization is really active and probably could also help, but I don't know, were you also impacted in the way you operate, and how could you continue the great work you're doing?
Yeah, it was hard because I think I mean, I'm a specialist nurse myself by trade and still do some nursing. And there was a real sense of wanting to do something more. Which was a weird feeling, really, but it was nice to be able to support some of the specialist services, the specialist hospitals. So we took a number of the patient calls from
very good.
The nurses there were being redeployed into, you know, COVID wards or palliative care or whatever. So that was something really positive that we were able to do. So we were pleased to be able to help with that. Obviously, we had to try and keep a community spirit alive.
And
that's really our main function, I think, both as a UK organisation, but INCA as a global organisation, is trying to, you know, to develop that community, to provide that support structure. And we had to adapt the way we did that because there's no way we wanted to close that off. So we use innovative technologies and kind of just think,
like we all did, and we all were pushed into.
Absolutely. And it's amazing how quickly we can change, I think, when we've got it.
I mean, I think, as you say, patients are afraid to go to their centers and afraid to even ask. I mean, do you have any advice to patients how they could cope, what they can do in this period?
Well, yeah, I mean, we had sort of differing approaches, really. But what's difficult when you're just over the phone with a patient is to understand the level of urgency. And we wanted to ensure that people at least spoke about what their concerns were and try in some way sort of utilize those conversations to say, right, you know, in our mind, that feels like an emergency. It feels like you need some medical input, and trying to encourage even if they didn't want to go into the hospital, encourage them to contact their teams, because there were some scary calls that we've had, people that were, you know, vomiting and had dreadful, you know, stomach problems. A huge increase in pain was reported. A couple of people that obviously had bowel obstructions that were just sitting at home, able to drink. They're like, I can't go in. And we had to just try and sort of talk through the risk benefit of anything that they were doing, to try and manage what was an emergency and what wasn't. And that's really difficult to do over the phone. You know, that's the job of the medic and the nurses in the hospital when you see people face to face. And I think everyone's been challenged by that.
So, you know, from your work, Catherine, what do you see that we could take and advise others to do? What did we learn, and how do we need to prepare for the future?
Yeah, I think, you know, I think we've learned a lot. I think we've learned a lot about the fact that we can use, you know, innovative technologies to help treat our patients. We can change our processes. We can adapt the way that we work. I think we've learned that we need to communicate better. I think communication is the key. I'm always banging on about it, but we need to communicate better, have full transparency. And I think that leads to some sort of solidarity, which is something that we definitely need. We need to keep the spirit alive, and we need to keep fighting through this. You know, the processes that we have changed and the way that we have worked, that we've adapted, we need to look back at those and see which ones we can take forward, because I think some of them were positive changes, and it was amazing how quickly we could change those processes when we really had to. But I think some of them are better for our community. I think learning from each other is going to be very important across the country and across the globe. And I think also, you know, from a UK perspective, thinking of the effect on the sort of mental health of our community. I think when we're looking to move forward, you know, in any of these kind of recovery and restoration plans that we're going to have, we need to make sure that we've got strategies in place and we've got structures to just support everybody through what this next phase is going to look like. I don't know what that's going to look like. I think it's early to say. 2021 is probably going to be a big year for everybody across the globe, but we need to stick together. We need to have solidarity, and we need to stay strong and keep that spirit alive.
Yeah, wonderfully said, Catherine, and I couldn't agree more. I think it really comes down to the communication, as you said, the resilience, solidarity, and really keeping up the spirit. I agree, mental health is a very important topic for cancer patients, and I think we really need to be able to provide them support, especially in such a crisis. So, Catherine, it was wonderful speaking to you. Thank you so much for your time, and keep on the great work that you are doing for patients. Thank you so much.
Well, thank you, Susanne. It was my pleasure. Thank you.